The COVID-19 situation explodes in Alberta, and so too do frustrations. Good evening, I'm Tara Overholt, and I'm live here outside the Health Minister Tyler Shandro's office, where overnight a mock cemetery hopped up. And as you can see now, these gravestones are paying tribute to a teacher, a grandmother, and then things like personal responsibility and Shandro's integrity. It's a clear mocking of how the government is handling this second wave of the pandemic. Our daily case numbers rival that of Ontario and Quebec, as we have recorded over 1,500 new cases for the past 2 days. However, the government is preparing to act tomorrow.
This is like a snowball rolling down a hill, growing bigger and faster, and it will continue unless we implement strong measures.
Moments after today's briefing, Dr. Deena Hinshaw meeting with the province's Emergency Management Cabinet Committee to give her recommendations on what those measures should be. But Hinshaw insists it's the politicians who will decide what actions will be announced Tuesday.
There are a variety of options for consideration, and the decision-making, of course, as I mentioned, is not easy. It will be up to elected officials to make a determination about what policy options they will choose, and my role, again, is simply to provide recommendations.
Dr. Hinshaw announcing 1,549 new cases over the last 24 hours from over 19,000 tests. The positivity rate sits at just below 8%. 5 new deaths were announced for a total of 476. 328 people are in hospital with 62 in the ICU. The active cases are now over 13,000 right across the province. Tracking who those people have been in contact with has been incredibly difficult for a number of reasons, like a lack of staff, and due to a major backlog in cases, there's a change in priority.
In order to maximize the effectiveness of the team, I have asked AHS to start with the most recently diagnosed cases and work backwards, trying to reach as many cases as possible, but prioritizing the cases which will have the greatest benefit in reducing further transmission.
Hinshaw says that if 10 days have passed since you've received a positive result, you will not get a call, but rather a text message with instructions about tracing, isolation, and other concerns.